Hi everyone, thank you for joining our webinar, Adolescent Mood Disorder, Identifications and Interventions. I'm excited to introduce our two panelists, Dr. Rhonda C. Boyd and Dr. Cherie Gerstadt. Dr. Rhonda C. Boyd is an associate professor in the Department of Child and Adolescent Psychiatry and Behavioral Sciences at the Children's Hospital of Philadelphia, or CHOP, and the University of Pennsylvania Perelman School of Medicine. She is the Associate Director of the CHOP's Child and Adolescent Mood Program in the outpatient clinic, where she practices as a licensed psychologist, specializing in evaluation and treatment of youth with depression and suicide risk. She has served as the principal investigator and co-investigator on multiple federal grants, including those from the National Institutes of Health and the Maternal and Child Health Bureau. Her research has focused on maternal depression, developmental psychopathology, and preventative interventions. Recently, she participated on the work group for the Congressional Black Caucus Emergency Task Force on Black youth suicide and mental health. Next, our second panelist, Dr. Cherie Gerstadt, is a psychologist in the Department of Child and Adolescent Psychiatry and Behavioral Sciences at CHOP as well. She works in the hospital's Child and Adolescent Mood Program in the outpatient division, providing evaluations and treatment to youth with depression and suicide risk. She provides direct services to youth as well as supervises clinicians in training and doing this work. Thank you so much for joining us today, Dr. Boyd and Dr. Gerstadt. Before you two get started, I just wanted to remind everyone to please send any questions that you have in the chat, and we'll try to get to as many at the end of the webinar. Thank you.
Good morning or good afternoon, depending on what time zone you're in. So as it was mentioned, we will be talking about adolescent mood disorders today. During an overview, I'll be presenting much more on some of the prevalence rates, risk factors, and Cherie will go more into interventions. And so we look forward to the questions that you all have to give to us, and hopefully there'll be an interesting discussion. I am trying to move, I'm sorry. Okay. I am going to get out again and start over because I'm not being able to move my screen. Okay, let me try again. There we go. We got it now. So I'm going to first talk about what we describe as major depressive disorder, what most people consider depression. And so for depression, to be able to diagnose it, it includes 5 or more symptoms during the same 2-week period. And so one of the main symptoms is depressed or sad mood, typically what we would think about with depression. But also for children and adolescents, I want to note that they can have irritable mood. And so most people are not aware that that is pretty common for children and adolescents. And also a loss of interest in activities. So you have to have this mood, either depressed or irritable mood or loss of interest in activities to be able to diagnose major depressive disorder. And then you have to have several more of these other symptoms. That includes a loss of appetite, or you can have an increased appetite. Sometimes people sleep too much, and sometimes people sleep too little, so they have insomnia. So both are associated with major depression. Some people may have increased movement, so they're kind of more agitated, and then other people, they're just slow, they talk slow, they move slow, and so that's associated. And then being fatigued, very tired is a symptom. Feelings of worthlessness, or sometimes people feel guilty about things that other people wouldn't tend to feel guilty about. Poor concentration is also associated a symptom of depression, or trouble making decisions, small things like, I got to figure out what I'm gonna wear today. And they may take an hour trying to decide things that should take quicker time. And then thoughts of death. Suicidal ideation is associated as a symptom of major depression. Next, I'm going to talk about bipolar disorder 1. There's a couple different forms of bipolar, but I'll just go over the first one. If people want to have more questions about other types, we can talk about it later. So you can have a symptom of major depression, major depressive disorders, as I went over, and or signs of mania. And for bipolar disorder, you have to have this high mood, and that's probably what people tend to associate, or the mood could be irritable. And so this irritable mood, which is kind of slightly different from depression, is more explosive irritable mood. And so you may hear people like maybe arguing with people outside in public, they may like hit walls. So it's a little more than the depression, irritability you see with just major depression disorder. And this lasts for at least 1 week where someone has these symptoms. And then they must have at least 3 more of these manic symptoms, which I'm gonna just talk about next. And that could mean increased activity. So they're constantly doing something. And that's probably what people often associate with mania. They may talk rapidly, have like this pressure to talk, jumping, racing thoughts, jumping from topic to topic, needing little sleep. So you can get like 2 to 3 hours of sleep and feel totally fine, not being tired. Also, some people with mania think that they can do anything. They have special powers and feel like they're on top of the world. And then they also may do risky things, spend all money, maybe go out and do things they wouldn't typically do when they're not in that manic phase, but puts them at risk for harm. So these are the manic symptoms that a youth must have in order to be diagnosed with bipolar disorder. And then I want to mention something called persistent depressive disorder. It's not often talked about as much. It used to be called dysthymia. And so this is kind of the person that's kind of always have a low mood. It's kind of more chronic, but maybe less severe. So someone having a depressed mood for most of the days for 2 years or more, and that's with adults. But for children and adolescents, the duration is for 1 year. And their mood can be irritable during this time. And they have to have at least 2 of the other symptoms of major depressive disorder that I mentioned, like maybe symptoms of being tired and having eating disturbance. And this is little time feeling well. So they're kind of depressed most days, and then there's very little time of feeling well. These are kind of the major mood disorders that children experience. And it does apply to adults also. One of the things that is particularly relevant is that for youth, many times parents are trying to figure out what is normal for adolescents particularly, and sort of also what is, a disorder. And so I went over some of the symptoms. And one of the things I do want to mention is that if you see a child, adolescent experiencing these things for long periods of time. And so we're talking about, weeks. Sometimes it's hard to tell that someone is sad. You may see some of the more physical symptoms if they're not eating, sleeping too much, much more about, paying attention to it. Sometimes I hear parents who are waiting for the phase to get over and it doesn't get over. And so it's better to try to get help sooner than later. I want to talk about some of the prevalence rates. This is from 2015, and this is for the major depressive episode. As you see, in 2015, the rate was 12.5% of the population of adolescents, and these were from 12 to 17. So one of the things, if you notice, there's a gender difference, particularly, and also that during adolescence, at about 15, the rates jump up and stay fairly consistent. And so that sort of indicates, how depression functions with youth. In particular, there's some racial ethnic differences. The highest group at that point was youth adolescents that had more than one race or ethnicity were at the highest risk, and then white youth were next. But there are some racial differences that may be changing as time go on, and when these research is updated, these data, we will learn more. I want to present some information from the Youth Suicide Risk and Behavior Survey. This is a survey given to high school students every 2 years. And it asks a whole bunch of questions about a lot of different symptoms, behaviors that adolescents do. Someone looked at the years from 2009 to 2019. And this is a rate of them reporting depression symptoms over this time period. And as you see, the rates are increasing both for males and females separately. So what is particularly going on over these last few years? There's been a peak in depression symptoms, and there's great concern about that youth are experiencing more depression symptoms now. I want to talk a little bit more about the rates with females and males, boys and girls. Prior to adolescence, boys and girls have similar rates of major depression. And so during adolescence is when there's this shift when girls are 2 times more likely to have major depression. And that's what you saw in those charts before about that difference between the girls and the boys. And this trend between boys and girls go on into adulthood. One of the things that is interesting is that the rates for bipolar disorder are similar across males and females across the age group. So this is particularly for depression where there's this gender difference. So people have always asked, why are girls at a higher risk? And these are some of the things that have been noted, that there could be just differences in the way girls' brains occur and the structural changes that are occurring as they develop across their lifespan. Also, the hormonal changes can influence the brain. And as you notice from that chart early on, that this increase is happening during puberty. And so this could explain sort of the hormonal piece. Also, that girls may be more vulnerable and sensitive to risk factors of depression. And so this may be a reason why there's a gender difference, and there's gender socialization, that girls are socialized in our country to maybe express their feelings more internally, which may be different than boys, and that may serve as a risk factor for depression. Next, I'm gonna talk briefly about the course of depression. Most depression episodes will just on their own remit within 1 year, but one of the things is pretty difficult to predict what will happen with depression symptoms. And so one of the things that we want to look at is that when teens already have a depression episode, they're more likely to have other depression episodes, and that can continue into adulthood. And a small subset of these youth will develop bipolar disorder. And we may not be able to predict that as well. It may look like depression as teenager, and then we may have to watch to see how it looks later. Some of the problems associated with depression include problem in relationship, having academic problems. Also, depression occurs with other psychiatric disorders, such as anxiety, which is pretty common to occur. Things like social anxiety, generalized anxiety, as well as panic symptoms. Also, ADHD. Also, youth with depression have more medical problems. They use their health services more. They may have more stomach aches, headaches, those things, and get attention through their medical doctor. They are also at risk of suicide attempts and completion, and also with misusing alcohol and other substances. Some of the risk factors include family history of depression or any mood disorder. And also, as I had mentioned, youth with a previous history of depression are more likely to have others. Or social support, having stressful life events. This could be things within a family, it could be things in a neighborhood. Also negative childhood experiences that can happen early on. There's a lot of attention about adverse childhood experiences, trauma, abuse, and also racial, ethnic discrimination, also has been associated with depression. One other thing I just want to mention, LGBTQ youth, in particular, they are at risk for depression symptoms. There's data from the Youth Suicide Risk Behavior Survey, which I just mentioned earlier, in which they found that 54% of LGBTQ youth and 61% of transgender youth have symptoms of depression. And that's compared to 25% of non-LGBTQ youth. And in particular, there's higher rates of many of these symptoms that there are likely to be bullied and victimized. And so these things may go hand in hand with these youth are in particularly high risk. I want to just mention some things that come up, particularly with, in the media. This is Demi Lovato. She had been diagnosed with bipolar disorder as a teenager, and she had recently been quoted. For years, people said I was depressed. I actually didn't know myself why I was so upset and why I would have these episodes of mania. What I now know is mania. So eventually they were able to diagnose her with bipolar disorder, but it looked like depression when she was younger. And this is Extension, a rapper who has passed away, but in his music, he expressed the mental health symptoms that he experiences, the depression, thoughts of suicide in his music. And so youth are being exposed to these in sort of the images that they see in the media and with celebrities. Teens in treatment at our clinic at CHOP, we had them fill out a survey to figure out like what they were experiencing. And I wanted just to share some of this information with you. But these youth talked about how depression impacted their overall functioning, school, life in general, their extracurricular activities. They particularly talked about conflict and communication difficulty, both with family members, friends, and peers. So one teen talked about how depression distracts them from all aspects of life, relationships, jobs, school, everyday tasks, make them feel very negative about themselves. And so they are sort of express sort of what, how we describe depression, but they experience it throughout their life, and it does negatively impact their functioning. I want to switch over to suicide, as I had mentioned, that it is associated with depression, but it's also a symptom of depression. And so currently the rates for suicide, this is through the Centers for Disease Control, for youth between 10 and to young adults 34, suicide is the second leading cause of death, which is a significant public health issue. And I want to go back to some of the teens that we had fill out surveys. They actually identified suicidal behaviors in their surveys, even though we did not ask about it. They described having suicidal thoughts, attempts, plans, intent, and self-harm, cutting, burning themselves. And they also reported that these symptoms of suicide, self-harm behaviors as symptoms of depression, and some of them described that was the reason why they started behavioral health treatment. So one 19-year-old said, I started having suicidal ideation and I decided a long time ago that I wasn't going to let my life end with self-murder, so I got help. And so this could be an impetus to get treatment. I wanna talk about some of the suicide warning signs. You can have talk warning signs. Saying, I feel like I'm a burden for others. I feel like I'm being trapped. They may talk about having this unbearable pain. And then there's the mood changes, depression, as we have been talking about, irritability, which we've talked about, anxiety. Also, there could be this rage. And then there may be behaviors that you may observe. They may withdraw from activities. They may give away prized possessions, isolating themselves, sleeping too much. And one of the things you want to look at about a change in these symptoms. And so when a parent or any adult that see these signs, it's a red flag that this person may need help, this adolescent, and that you need to kind of gather more information and get them help. And this is on the American Foundation of Suicide Prevention, their website. They have these suicide warning signs as a reminder that you can look for. And I do want to end with talking about suicide contagion. In the media, youth are being exposed to a wide range of things. And this study kind of looked at, and I know it looks kind of weird with all these lines, but this is like calls to the crisis hotline. And we have a resource for it at the end. And this is actually based on 2 events that happened. So the first event is the second season of 13 Reasons Why. Many of you may have heard about that show. It was about a teenage girl who killed herself, and it brought up a lot of issues about being presented on TV. And so the second season was released, and what you see, the black line show that actually calls to the crisis hotline, and it jumped up, increased when that second release of 13 Reasons Why. And the blue line at the bottom shows when people specifically mention suicidal thoughts or behaviors in the crisis hotline, and that did a bump. And the second major red line was 2 celebrity deaths, Kate Spade and Anthony Bourdain. And similarly, there was increases in the crisis hotlines during this time. And so one of the things, this is a general population, but 55% of the sample was 17 and younger. And so this does represent youth. So I will end there. Oh, no, that wasn't the last, I'm sorry. Just want to briefly talk about COVID and that there's been a disruption based on COVID in our routines, our milestones, online learning. Youth are not, they're restricted in their interactions with their peers. And also they're having a lot of increased stress because of COVID. And hopefully at the end, we can talk about the impact of COVID. If people have questions about what does this mean for youth mental health, for depression. But there's been a lot of changes over this past year that have restricted, particularly teenagers, and how they normally function, because peer relationships are very critical to their development. So that's my last slide. I know for sure. Okay, go ahead, Cherie.
Okay, so I'm going to talk a little bit more about different kinds of therapy for depression and strategies that we use in these therapies. The therapies I'm going to talk about are ones that have been researched and found to be particularly effective for teens who are experiencing depression. So the first one is cognitive behavioral therapy, abbreviated as CBT. And it's based on the principle that thoughts, feelings, and behaviors are all connected and all affect one another in every direction. So what we're thinking affects how we feel and how we behave affects what we're thinking and how we're feeling. And this connection steers us towards where we intervene in terms of techniques. So part of the therapy is identifying thoughts that might lead to your depressed mood. Oftentimes the thoughts can be very negative and pessimistic, and there can be strategies to shift these thoughts to a more positive place in order to feel better. CBT also encourages activities that promote positive mood. So encouraging people to be active, to do things that make them feel good, to do things that they feel like they are good at doing. CBT can also teach problem solving and assertiveness skills, because negative life events are going to happen, and part of this is learning strategies and skills to problem solve, communicate to other people, and deal with those negative life events when they do happen. The next therapy I'm going to talk about is interpersonal therapy for depressed adolescents, also known as IPTA. So IPT really looks at the principle that depression develops in a social context, and it's influenced by interactions with other people. And this goes in both directions. How we feel and our mood affects how we interact with other people and our relationships with them. And then it also goes in the other direction, that our interactions with other people affect how we feel. And it's sort of a circle that can go around and around in either a negative direction or a positive direction. So with IPT, you provide education about those connections and interpersonal skills and communication skills and problem solving skills to intervene with those relationships and those interactions to have a positive effect on the person's mood. The last therapy I'm going to mention is family therapy. And family therapy is based on the principle that depression and family functioning both affect each other, again, going in both directions. You know, also family therapy with teens with depression acknowledges that it can be very stressful for a family to have a teen who's depressed, and parents and other family members might struggle with how to help that person and how to give them support. And in a family context, those issues can be addressed. Also within the family therapy, you can also teach communication and conflict resolution skills to make those interactions with family members as positive as they can be. So I'm going to talk a little bit more about specific coping skills and strategies. These are often strategies that are used in the therapies I just talked about in CBT and IPT, and sometimes in family therapy as well. So if you receive that kind of therapy, these would be the kind of things that it might include. Also, these are just some strategies people can use on their own to help with their depression. So the first set of skills that this slide is talking about, we call behavioral activation. And when people are depressed, they tend to withdraw and stop engaging in the things that they enjoy doing. When you're depressed, you withdraw, your motivation is lower, your energy is lower, and you stop engaging in activities. Again, that's a vicious circle because the more you withdraw and don't engage in activities, the more depressed you're going to feel. So the idea is to change your behavior so that it can change how you feel and your mood. Things to consider, steps doing, is to generate a list of pleasant activities that you enjoy, that you can do several times a week, that you don't have to rely on other people, that are not harmful in any way. So the idea here is just basic everyday activities. It doesn't have to be, you know, a trip to California. It's just things you enjoy doing, taking a walk, playing a sport, doing arts and crafts, you know, listening to certain music. But these are things, very basic things that when people are depressed, they withdraw and stop doing often. The list of activities should include a mix of things you do by yourself as well as things you do with other people. So there's options there. And it's helpful if it includes what we call success-related activities, which is things you feel like you're good at and you can feel a sense of accomplishment when you do them, as well as physical activities. So some sort of exercise, you know, and it doesn't have to be hardcore going to the gym for 2 hours exercise. Again, it can be a walk, but we know that with physical activities and the endorphins our body releases, that's something that can have a positive effect on mood. Again, the idea is to have a long list of activities so you have things to choose from, so that if it's a rainy day or it's cold outside or other people aren't available to do the activities with you, you still have choices of things you can do. So another set of skills we talk about is distraction skills. Activities are actually one kind of distraction skill. You know, with behavioral activation, the focus is really on activities that you find pleasant and you enjoy and bring you joy. When we're using them in terms of distraction, it's really just doing anything, just getting your mind on something else. When people are depressed, they tend to really, what we call, ruminate and focus on those negative thoughts and feelings, and kind of go around and around in their mind. So distraction skills, the intention really is to just shift your thinking, get your brain off of those negative thoughts. So one way to do that is just do an activity. It could be anything: call a friend, watch a TV show, play a video game. But again, it could even be something like cleaning your room. It doesn't have to always be something you enjoy if all you're trying to do is distract yourself. Another set of distraction skills is helping others. One thing we actually know from research is that what we call altruistic acts, so helping other people, is something that actually can really help depression. It helps people feel good about themselves. It helps them feel like they're accomplishing something. It helps them focus on other people. So any little thing you could do nice for someone, a teen could help a younger brother or sister in some way, make something for someone, volunteer somewhere. It gives them a sense of purpose and a sense of meaning. Another set of distraction skills is just trying to shift your emotions. So again, you're just trying to shift off of those negative, depressed feelings. So watch something funny, a TV show, a YouTube video, listen to upbeat music, right? We don't want depressed teens sitting and listening to depressing music, not so helpful. Again, do something active, get your body moving. The last one is to just do anything to replace your thoughts. So again, when we're depressed, our brains become sort of obsessive and very fixated on certain thoughts, tend to be negative, depressing thoughts. So you really just want to do something to shift that thinking again, reading, doing a word puzzle, crossword puzzle, even something like repeating the words to a song in your head. It's really just getting your attention and your focus off of those depressing thoughts onto something else. So sleep is also something we know is very important with depression. Trouble sleeping can be a symptom of depression. Again, it's a vicious circle that depression causes trouble sleeping, but if you're not sleeping well, that's going to add to your feelings of depression. When you don't sleep, it affects your mood, it affects your concentration, it affects your energy. So something that's very important to think about. One tip is to stick to a schedule. So to go to bed and get up about the same time every day. Teenagers can especially have a hard time with this. Adults, we get into this habit a little bit too, but often there tends to be one schedule during the week when they have school. Of course, with coronavirus, everyone's schedule is a little thrown, but what you want to watch out for is that then on the weekends, it's not shifting dramatically to a much later bedtime and they're sleeping in really late. The reason for that being if they sleep until noon on a Sunday, if they need to go to bed by 11 o'clock that Sunday night to get up for school the next morning, they're just not going to be tired. So it kind of throws their whole schedule off. Having a bedtime routine can be helpful. Changing into clothes, brushing your teeth, things like that, lowering the lights, lowering the noise level, reading. And this really is connected to the idea that our brains use sleep cues, what we call sleep cues. So there's things in the environment that our brain looks for to signal that it's time for us to go to sleep. For most people, that's getting into bed, turning the lights down, turning screens off. It can be helpful not to eat or drink a lot before bed, to eat dinner at least 2 hours before bedtime, and probably obviously not to drink a lot so you're not waking up to use the bathroom during the night. Avoiding caffeine and nicotine later in the day can be really helpful if you're going to have caffeine or nicotine, in the morning or early afternoon hours. Also exercising in the morning or afternoon. Exercise can be very helpful in terms of making someone tired and able to sleep better, but when you exercise too late in the day, sometimes that can have a little bit more of an activating waking up effect. More tips: keep your room cool. Our bodies just go to sleep easier with cooler temperatures. Sleep primarily at night. That's a hard one because if you're not sleeping well and you're tired, of course, the inclination is to take naps. The problem is that really throws off our sleep schedule because if you take a nap in the afternoon, you're not going to be tired to go to sleep that night. Also, in terms of getting restful sleep, our brains are more rested when all of the sleep happens at once within a 24-hour period, at nighttime rather than in little chunks throughout the day. Keeping the room dark and no screens. Of course, that can be a really hard one with teenagers too, because they're on screens a lot and before bedtime. But, one thing to really look out for is there's not a lot of screen use, a lot of texting, that kind of things, because it can make them more awake late at night as opposed to sleepy. Using your bed only for sleep. Again, that's a sleep cue that we want our brains to associate. Being in bed means going to sleep. So if you do a lot of other things in your bed, it's going to be confusing for your brain and harder to associate being in bed with going to sleep. Taking a hot shower before bed can help you to relax and get more tired. And our last one is don't catastrophize, which can be hard for all of us. When we're having a hard time going to sleep, a lot of times the thoughts go in our mind like, oh no, I'm not going to sleep. I'm going to be tired tomorrow. These are all the things I have to do tomorrow. So, as much as possible to be aware of those thoughts and tell yourself it's going to be okay. I'll go to sleep. I'll get through the day. This is not that big of a deal. Another set of skills that we often use are relaxation skills. These are particularly helpful if, in addition to depression, people are experiencing some kind of anxiety. Anxiety and depression often go together. People who are depressed are more likely to also be anxious. So these skills focus more on what we call kind of an anxious depression. The first one that many people might know is diaphragmatic or paced breathing, deep breathing. The idea is when you're anxious, two things happen to your breathing. You're breathing more quickly and you're breathing more shallowly, kind of like this. The extreme of that is hyperventilating. So to relax our body, what we want to do is really think about two things: breathing deep down into our belly and also slowing our breathing down. So you want to breathe in through your nose and out through your mouth. It's helpful if you place a hand on your belly and on your chest so that you can really focus on getting your belly to move. If you're doing deep breathing properly, your belly should almost blow up like a balloon does with each breath. And having your hand, especially for, you know, kids and younger teens, having them hold a hand on their belly can be helpful to be more aware of that. The other thing that's really helpful is having the exhale be longer than the inhale. This is something that's been researched, and it's very helpful to relax your body if the exhale is longer. So often people count to slow down their breathing. You could count in for a count of 2, 3, 4, it kind of depends on how quickly you count. But you want the count for the exhale to be longer to help you really focus on having that exhale be longer. The other relaxation skill we do is guided imagery. So there's lots of stuff on the internet. There's lots of apps now. There's lots of things on YouTube around relaxation skills, and guided imagery is one of them. So you sit with your eyes closed, and guided imagery involves kind of a voice telling you to imagine a certain scene. You know, usually a relaxing scene, often it could be the beach or the mountains, and you're really taking your mind to picture being in that situation. A lot of times the guided imagery exercises will focus on the senses. So picture, you know, imagine what you would be smelling, what you would be hearing, what you would be seeing, because that really helps your brain to imagine being there. And the goal is really to use your imagination to picture it going on in your head, kind of like a movie, to really imagine that you're there, and that will help you to relax more. The last relaxation skill is called progressive muscle relaxation. Again, there are many recordings that take you through this that are helpful to listen to, but you sit with your eyes closed and you focus on one muscle group in your body at a time, tensing that muscle group for 5 seconds and then relaxing it for 10 seconds. And you're focusing on really what it feels like for those muscles to be tense as opposed to relaxed. Social skills, as I said before, depression often leaves from withdrawal from others and people having a hard time communicating with others and compromising with others. This can be a downward spiral because the more that you're not communicating, the more it's going to hurt the depression. Things to think about are increasing social interaction. I'll actually talk about that more on the next slide. Assertiveness skills is helping people to express their frustrations as opposed to either being passive or aggressive, but just asserting themselves in a calm and effective way in terms of what they need. And the last set of social skills we often focus on is helping people to be able to listen and compromise, so that even when you disagree with someone, you're able to listen to them and using problem-solving strategies to solve what's going on. Strengthening social support. So these are really basic things, but often when people get depressed, they stop doing them. And this is something that we draw attention to. So meeting new people, getting closer to the people you already know, having less arguments with people that you care about, doing more activities with your friends or your family, and trusting people enough to ask for help. Again, as Dr. Boyd was talking about, we know a lot of these things are hard in the time of COVID. So being able to do activities you enjoy, being able to feel connected to others, being able to see others is a real challenge for everyone right now, but also really important for people to think about reaching out and staying connected to other people. Problem-solving skills are another set of skills we talk about. Obviously, problems create stress, and when people are depressed, their concentration is affected, their thinking is affected, they often think more negatively, and that can be really hard to just solve basic problems. The acronym we often talk about is STEPS. So you state the problem, think of the possible solutions, examine each solution, and then pick a solution and try it and see how it works. a key aspect here is for all of us, when we have a problem, when we start thinking about solutions, our brains often get a step ahead. And as soon as we think about the solution, we're thinking of the reasons why it might work or not work. So we really want to slow that down, and you are just brainstorming, coming up with possible solutions without thinking about whether they're good ones or not. And then when you have that list, you're really going back and thinking about the pros and cons of each option. This is additional information. Dr. Boyd and I both work at Children's Hospital of Philadelphia in the CHAMP program. This is a link to our website. And then also the National Institute of Mental Health has a lot of really useful information about depression treatment, things to look for, ways to get people support. The last slide to make everyone aware of is the free support that anyone can get 24 hours a day, 7 days a week. The National Suicide Prevention Lifeline is available all of the time to everyone across the country. It doesn't have to only be if someone is feeling imminently suicidal. It can just be any crisis of any kind that it would just be helpful to have someone to talk to. The crisis text line serves the same purpose, but is texting instead of talking. And often teens really prefer that. It's been surprising to me how much teens will reach out with a text line as opposed to having to have a conversation with someone. And the last one is SAMHSA's National Helpline. That is more just a hotline that is available to give people resources and support to even connect you with treatment in your area, to give you any sorts of information that might be helpful. So that is it. I don't know if we want to leave the slide up or
You can just leave that up for the Q&A.
Okay, sure.
So thank you so much for that wonderful presentation. It looks like we have time for a few questions. So I'm just going to get started with those. Our first question is, someone wanted to know, how can teens who are struggling during the pandemic seek help?
Rhonda, did you want to take it or you want me to?
I can take it. I didn't. Part of it is there can be multiple ways. You could let your primary care doctor know about it. Sometimes the primary care doctors often have resources, therapists that they may connect with, that they refer their patients. So that's one option. Also, through the parents' insurance, typically on your insurance card on the back, they have sort of a someone to call for mental health, because usually it's kind of separate from your general medical insurance, the behavioral health. And you can call your insurance company and find places within your insurance network that that look for teens. Also, sometimes schools have resources in which they may be able to have providers that they use or have counselors in the school. So those are 3 potential options. I'm not sure, Cherie, if there's some others that I may not have mentioned.
Certainly those are the ones we often look at. I mean, I know right now with COVID, things are really difficult and kids aren't in school. Hopefully they still have connections to adults at school that they can reach out to. You know, you also could reach out to any of the information that's on the screen, and those resources could help direct you.
Okay, great. Thank you so much for that information. Our next question is, someone wanted to know what a good first step is for a parent who notices that their child may be struggling.
You want me to take it, Rhonda? Or
Yeah, as well, yes.
we can go back and forth. So, you know, this is a really obvious thing, but talk to your teen. Often parents and other adults worry that talking to their teen is going to make it worse or upset the teen. And often it's the opposite. The teen wants to talk about these things, but doesn't know how to. People, even with suicide, people have the idea of they shouldn't ask teens about suicide. It'll put ideas in their head or make them suicidal. And actually research has shown the exact opposite, that if you're worried about someone being suicidal, talking to them decreases the risk. But, you know, talk to your teen and say, I've noticed you don't seem yourself. You seem different. You seem sad. You seem like you're sleeping a lot. You know, what's going on? I mean, the teen might not want to talk to their parent about every single detail, but I think they might be relieved to just be able to say, yeah, I am really struggling and I didn't know how to talk to you about it. If there's another person, adult in the teen's life, whether it's a grandparent, an aunt, an uncle, a teacher, a coach, that they have a close relationship with them, you could also try to have them talk to the teen. But, ultimately, you do want to reach out and get them help with a professional, because that person is going to be, trained to really talk to your teen and help you to figure out what's going on and what the best next steps should be. And there's nothing to lose by doing that. And problems are a lot easier to deal with when they're smaller problems than when they become bigger problems. So, we really encourage as families to reach out if they have any concerns, and don't wait till it becomes a much bigger problem.
Thank you, Cherie. And then someone else asked, do you guys think that depression rates in younger people may be increasing because information is more readily accessible, which could cause them to be more receptive to symptoms?
So the rates are increasing. I'm not sure if it's because of the information. We don't necessarily know why depression symptoms are increasing. I think there are more stresses on teenagers, youth today than may have been, as I showed statistics from 2009. Society is very different. There's a lot of information to process. We know particularly people want to think about whether social media is that. There's no direct evidence, but youth are being exposed to a lot of information that they're sometimes processing information that they're not cognitively able to process. And so I do think there's additional stressors that young people are experiencing, but we don't have the exact answers of why. I don't think just having information about depression is the reason.
Okay, thank you for that clarification. And then lastly, a few people wanted to know if they could have access to these slides after the webinar.
How that be done? Is there any way?
Yeah, I think
Yeah.
we're open to it as long as we figure out the logistics of what that would look like. I mean, I know you're going to post it on YouTube, so I imagine they would be there, but we're happy to provide information in whatever way we can.
Okay, great. I'll talk to you guys about this after the webinar and we can figure something out. And then I'll let everyone else know the information about that.
Okay.
Okay,
great.
so that wraps up our Q&A. Thank you so much, Dr. Boyd and Dr. Gerstadt, for this wonderful presentation.
You're welcome. We are glad to be with you.